Our next presenter is Maria Goheen, and Maria did her practicum with CASA, which is the Court-Appointed Special Advocates of Missoula. And Maria's site mentor is Margaret Person, and she's the program manager there. And the name of Maria's presentation is Aging Out of the Foster Care System. So take it away, Maria.
Hi, good afternoon. My name is Maria Goheen. I'm a public administration and public health student here at UM. I've had the privilege to work at CASA of Missoula. Like Lee mentioned, it stands for Court-Appointed Special Advocate. We support and recruit volunteers who advocate for abused and neglected youth in the court system. And so this led me to my practicum topic, an area of interest of mine, which is analyzing foster youth's transition into independence. And I want to thank Margaret Pearson, the program manager at CASA, and Lee, my advisor, for their patience and assistance. Oh. And so first I want to define the issue. So what's happening to youth when they enter the foster care system? So over 440,000 children are in the foster care system, and over 20,000 foster youth enter independence at the age of 18. So they lose support and resources from the state at that time. It's important to understand the experiences that lead youth to the foster care system. So in Missoula County, the three leading reasons for youth to enter the system is neglect, substance abuse, and methamphetamine use. So that typically is happening simultaneously. Additionally, beyond substance-related neglect, 26% were removed due to mental health issues in the home, 20% because of housing, 17% because of physical abuse, and 2% for sexual abuse. So adverse childhood experiences, or ACEs, occur from traumatic experiences such as violence, abuse, neglect, being in a household with substance use, mental health problems, and instability. These are all common experiences of foster youth. And ACEs have negative impacts on health and well-being. These youth have higher likelihoods of developing chronic conditions, obesity, poor school dynamics such as bullying or isolation, and lower resiliency. Adults with ACE scores of 4 or higher are 1,220% more likely to attempt suicide, 1,003% more likely to use injected drugs, 460% more likely to have depression, and 390% more likely to have lung disease. Adults with ACE scores of 2 or higher are 400% more likely to consider themselves as an alcoholic, and 5 of the 10 leading causes are associated with ACEs. So this leaves foster youth extremely vulnerable to significant negative health outcomes. And this can be seen with the statistics showing that 25% of former foster youth will attempt suicide, 81% of young men will become incarcerated, 71% of women will become pregnant before their 21st birthday, 40% will become houseless within 18 months of independence, and 97% will enter chronic poverty. So that leads me to wanting to understand what we can do better to support this vulnerable population. And I did this by sending Google surveys to CASA volunteers who were currently or recently worked with a teen or youth that aged out of the foster care system. Additionally, I contacted social workers and lawyers who work closely in dependency neglect cases. I received 8 CASA volunteer responses and conducted 4 interviews with social workers and 1 with a child and family attorney. So while this isn't a large sample size, I received immense information from them, and they're all very gracious with their time and truly cared about what the goal of this project was, which was to alleviate barriers and improve health outcomes for former foster youth. So here's what the Google survey looked like. They were asked questions such as what organization was the most beneficial in preparing their youth for independence, what resources seemed valuable, and what were the largest barriers and issues when working towards preparing their youth. And then here are the questions that I asked social workers and lawyers. So again, there was a focus on uncovering what organizations were the most beneficial and what were the issues or barriers identified when preparing youth for transitioning into adulthood. And so these are screenshots of just a smidget of all of the findings that I received, and I put them all into Excel sheets. And I found that 90% of CASA volunteers interviewed said they discussed topics with their foster teens, such as housing, employment, education, life skills, and mental health. Mental health was mentioned by 50% of participants as a main barrier to successful transition. And the remaining responses included education, income, housing, and lack of human connection. Resources that volunteers believed would be beneficial was improved preparation strategies and mental health resources for foster youth prior to transitioning into independence. 20% of participants felt they were unprepared to effectively prepare their youth for adulthood. And when interviewing social workers and lawyers involved in foster youth cases, 100% mentioned employment, mental health, social support, and housing as main barriers for these young adults. And so with this data and the conversations I had with volunteers, social workers, lawyers, a similar theme appeared of a greater need for preparation for both the CASAs and the youth. So this led me to the creation of a roadmap for use by CASA volunteers, a roadmap that could simplify the approach for CASAs while ensuring that youth are aware of accessible programs and resources in their area. I work closely with a social worker within Child and Family Services to ensure that this roadmap would be a clear, accurate representation of what should be done to prepare a foster child for independence. And so this resource is a place that volunteers, no matter their background, can utilize to ensure they are confident and effectively advocating and preparing their youth for success after aging out of the system. Due to the overwhelming nature of the foster care system, it's really important to be prompt and even proactive when signing a youth up for resources, benefits, or programs. The roadmap is outlined by age. So for instance, at 14, these are the programs or resources to sign up for or confirm with their CPS worker about, such as Medicaid, the Chafee Foster Care Independence Program, or youth-centered meetings. Then so on at 15, 16, and 17, there's detailed and precise explanations of what and how a CASA should ensure their youth is up to date and prepared for when they turn 18. So this is a guide including important resources that may seem overwhelming to both the CASA and the child, the young adult, trying to navigate through the court system. And so then additionally, there appeared to be a greater need for support when approaching housing, employment, and basic life skills when becoming independent. So I included a resources section, and with collaboration with organizations and social workers, I was able to make a very detailed list for Missoula with statewide links and titles of different areas such as employment, housing, clothing, food, for those who are out of the Missoula area. I'm hoping that CASAs who are aware or find more resources within or external to the Missoula area that are not mentioned will send this to CASA staff to update for this to be an up-to-date, accurate, and helpful tool for CASAs to better support and advocate for their youth. And so the foundational competencies accomplished through my deliverables were the collection of both quantitative and qualitative data methods for a public health context. So I use surveys and interviews to collect data to better understand areas for growth, to support and prepare foster youth for independence. I created a project, also an intervention tool, which was the roadmap for a specific vulnerable population, foster youth, specifically in Missoula and Mineral County, but for room for growth for the state of Montana. I found common ground and collaborated with CASAs, lawyers, social workers through surveys and interviews, and advised further connection with local and state organizations through the roadmap to improve health outcomes for foster youth. The concentration-specific competencies accomplished were identification of common characteristics of rural areas in Montana and within Missoula and Mineral County, being the need for greater accesses to resources such as mental health services specifically and housing. Through the deliverable of the roadmap, I hope to assist some of the gaps that CASAs face when trying to support their youth in an area that they're not familiar with. Additionally, through collaboration with CASAs with different points of views and experiences, along with social workers and lawyers, I was able to create a resource available for people of all walks of life, no matter their situation or background, to utilize in efforts to improve foster youth's health outcomes. And so while I'm very pleased with the results of the surveys and the interviews, it was a smaller amount of responses than I was hoping for. So the interviews and surveys that I did collect were quite thorough and provided great insight, but a larger sample size would improve the reliability and the generalizability of the data. Additionally, another limitation within this work was the vast array of responses and experiences. So each case and foster child has a complex and unique experience, such as their family situation, their location, their school and friends, and other variables, which makes their responses varying drastically on their specific needs and obstacles within that case. I do believe that the roadmap and resource list gives CASAs a great foundation and improved confidence when advocating for teens, but there's still going to be some work to be done to ensure that foster youth health outcomes can be improved. Confidentiality played a role in my research, as working with vulnerable group created many hurdles when applying for IRB. I was able to work anonymously with CASAs and other professionals, but I did not have any direct interaction with foster youth. I believe another level of advocating for youth is to hear from them directly. However, that was not a possibility within this research. Additionally, within the roadmap, there is room for expansion of resources in the Montana area. And I hope this to be a working document in order to best help CASAs and the youth they are advocating for. And so lastly, I want to make special thanks to the CASAs and the social workers and the lawyers who helped me throughout this process, not only for the hard work that they do every day, but for taking the time out of their busy schedules because of the passion and dedication they have for their work. And so I really hope that this can help fill a gap in efforts to improve the standard that we have for the outcomes of foster youth. Thank you.
Thanks, Maria. Great job.